Hello everyone. So through this video we are going to understand oxygen dissociation curve, a basic physiology understanding in respiration. So oxygen dissociation curve tells us about how oxygen is being dissociated at the level of tissue and how it is getting associated with hemoglobin. Okay. So let's try and understand some basic that oxygen 97% of which is carried in our body as oxyhemoglobin. Hemoglobin is a quaternary protein having tetrameric structure, means each hemoglobin molecule can bind to 4 oxygen, okay, and carry it in our body. And this is how 97% of oxygen is carried in our body, and leftover 3% is carried by plasma in the blood. Also notice that 100 ml of blood can carry about 20.1 ml of oxygen, means one hemoglobin molecule actually can carry 1.2 ml of oxygen. Okay, these are some facts you need to remember. We will go on and understand now oxygen dissociation curve. So oxygen dissociation curve has in x-axis PO2, that is partial pressure of oxygen in millimeter of mercury, and in y-axis we have percentage saturation of hemoglobin, and this saturation is with oxygen, means how much hemoglobin is bound to oxygen. As the PO2 will increase, PA percentage saturation of hemoglobin, that is binding of hemoglobin with oxygen, will increase until there is some saturation, and this saturation will be reached because hemoglobin is a tetrameric protein, and eventually oxygen will bind to all the tetramers and there will be saturation of the hemoglobin. Okay, so let's try to understand this graph first. The basic understanding is that in a normal situations, when the PO2 will increase, the binding of the hemoglobin with oxygen will increase. This is a normal phenomena, and then this should be a linear graph, but this is not so. There is a sigmoid graph seen in case of oxygen dissociation curve, and this is because of a phenomena known as cooperative binding. Now what is this cooperative binding? We already understood that hemoglobin is a tetrameric protein, that is a quaternary protein, and quaternary protein has 4 sites for oxygen binding. When the first molecule of oxygen binds to the hemoglobin, it binds against the maximum resistance or maximum force it has to overcome. But after binding of the first oxygen molecule to hemoglobin, there is conformational change in this hemoglobin molecule. And this hemoglobin molecule now can easily bind to the leftover 3 oxygen molecules. And this is why the binding of first oxygen facilitate the binding of the leftover 3 oxygen. And rather than a linear graph, we are getting a sigmoid graph. And what is this sigmoid graph now? At the same pressure, the percentage saturation will increase because of this linear sigmoid graph rather than linear graph. This was basic understanding. Now let's try to incorporate the oxygen dissociation curve into understanding of how oxygen is being dissociated at the level of tissues and what is going to happen at the level of lungs. So at the level of lungs, we know lot of oxygen is getting inhaled, and we have maximum oxygen gradient at the level of lung. So increased binding of oxygen will be seen, and there is increased affinity of oxygen. Because of this increased affinity of oxygen, due to more concentration of oxygen and increased binding, there will be left shift. Let's try, and this left shift is actually known as Haldane effect. Let's try to understand what this increased affinity of oxygen actually means. So one thing we need to remember is that with certain pressures, the saturation of hemoglobin with oxygen is going to increase. And one such pressure we define is P50. Now P50 is a pressure at which 50% of hemoglobin is saturated, and generally this P50 comes out to be 27 millimeter of mercury. Okay, now what actually happens when the graph shifts to left is the P50 also becomes less, means now the pressure required of oxygen to get 50% saturation of hemoglobin has reduced to less than 27 millimeter of mercury. And this has happened because the affinity for oxygen has increased. Why this affinity has increased? Because we have higher concentration of oxygen at the lung level. And why this is? Because we have increased binding of oxygen. And why there is increased binding of oxygen? We have lot of oxygen reaching, and oxygen here gets diffused via normal passive process, and this passive process of simple diffusion is dependent on the concentration gradient. Since we have maximum concentration, there is going to be increased binding of oxygen, and increased affinity of oxygen is going to cause the left shift of the graph. Okay, and this left shift is what is known as Haldane effect. I hope this Haldane effect is now clear with everyone, that because of increased affinity at the lung level for the oxygen, we have decreased requirement of the partial pressure to attain the 50% saturation of hemoglobin, and this is known as left shift or the Haldane effect. Now let's try to understand what is actually happening at the tissue level. At tissue level, we are going to have oxygen affinity decreased, and we will have lot of CO2 increase because of the venous blood returning from the tissues. Okay, lot of venous blood with lot of PCO2 increased will be in the tissue level, and there will be decreased oxygen affinity. Because of this decreased oxygen affinity, now at the same P50 we will have less saturation of the hemoglobin, and for reaching P50 we will have to require more pressure. Means rather than 27 mm of Hg, we will require more PO to get 50% of hemoglobin saturation, and this will cause a right shift, and this right shift is what is known as Bohr's effect. Okay, I hope it is again clear that P50 was some pressure at which 50% of hemoglobin was getting saturated. But in case we have higher affinity for oxygen, this P50 will be less than 27. And in case we have less affinity for oxygen, the PO2 will be more than 27. This left shift is known as Haldane's effect, and the right shift is known as Bohr's effect. Now, in important factors which are going to cause this shift, that is Bohr's effect and Haldane's effect, is what we need to remember. We will have a conceptual explanation for it first. So let's try to understand how right shift is occurring. Right shift is occurring at the level of tissues, and it is known as Bohr's effect. Okay, at the tissue level we have increased level of CO2, that is partial pressure of CO2, and this is known as hypercarbia. We also have decreased concentration of oxygen, and this decreased oxygen at the blood is known as hypoxia. We have two things happening, hypoxia and hypercarbia. We know when there is hypercarbia, CO2 is going to bind to the water, and it is going to lead to formation of bicarbonate, and then this bicarbonate is going to break into H plus plus bicarbonate ion. This H plus formation is increased in case of hypercarbia, so we know this. So in case either we have hypoxia or we have hypercarbia, or we have increased H plus because of increased CO2, that is acidosis, these three factors will cause a right shift, and this is because of this is what can lead to right shift. Not only this, in case we have hypoxia, there will be anaerobic glycolysis, and in anaerobic glycolysis we have increased formation of an metabolite, that is 2,3 bisphosphoglycerate or 2,3 diphosphoglycerate, and this also will increase. Two more things that can lead to increased right shift are exercise and temperature. Now how this is so? So actually during exercise we have lot of metabolic processes going on in our body, and these metabolic processes are going to consume lot of oxygen, and because of this increased consumption of oxygen, there will be decreased oxygen level and decreased oxygen affinity, an increased level of CO2 at tissue level, and increased exercise also lead to metabolic processes that leads to an increased temperature. So both of this exercise and temperature are going to cause right shift. Also high altitude leads to hypoxia at a chronic level, and it can also lead to right shift. So the basic things that were leading to right shift were hypoxia leading to hypoxia. Okay, this is because of decreased PO2 at the tissue level, because of increased consumption of oxygen at tissue level seen in cases of exercise, temperature rise because of exercise, or we have hypercarbia because of the venous blood filled with CO2, hypercarbia leading to acidosis, and hypoxia leading to increased synthesis of anaerobic glycolysis metabolite, that is 2,3-DPG. And this all can be remembered by a mnemonic, that is CADET. It is a well-known mnemonic already. CADET always faces right. Okay, this is the mnemonic. So cadet is someone who will always face right. Okay, he will always have the eye pointed to the right. And this cadet stands for C, that is CO2, that is hypercarbia. A for acidosis, that is because of increased CO2. D is 2,3 dpg here, whose level is increased. E is exercise and T is temperature. So these factor will cause a right shift. Cadet always faces right. In case, and this is what is known as Bohr's effect. In case of left shift, that is Haldane effect, what will be seen. So this is up to you to understand, and means let's revise it once again. In the case of left shift, that is Haldane's effect. There is increased oxygen binding at the tissue level, at the lung level. That is why at even the less PO2 we are getting P50. Okay, so there will be increased oxygen, there will be hypocarbia, there is decreased level of CO2, and there, because of this decreased level of CO2, we will have alkalosis in the patient. Okay, and these feature will cause left shift rather than the right shift. So the features causing left shift will include alkalosis, hypocarbia, in decreased level of 2,3 dpg. These will be completely opposite to what we studied in right shift. So I hope you understood some basics of this topic. Also, one more important thing we need to know by this oxygen dissociation curve is, let's try to understand this. So we have some amount of hemoglobin that is getting saturated at certain PO2. Now consider a situation, we have anemia. In anemia, the patient has low concentration of hemoglobin. So there is no benefit of increasing a lot of PO2 in patient to attain a certain level of saturation of hemoglobin in such patients. Because an anemic patient with breathlessness, you go on increasing the PO2 to attain a certain level of saturation of hemoglobin. This is not going to happen. We need to transfuse the blood and get a certain level of the hemoglobin first, because then only the saturation can be attained in a good level. Otherwise, there is no benefit to a certain level. I hope you like this video. Thanks for watching.